Hi guys, my name's Sanjay Gupta. I'm a consultant cardiologist in York Hospital, and today I thought I'd do a little video on the subject of vagal atrial fibrillation. Vagal atrial fibrillation is a poorly understood condition, but it is important because of many reasons. The first thing is that the treatment of vagal atrial fibrillation is different to other forms of atrial fibrillation. The second thing is that a lot of people don't actually look for vagal atrial fibrillation, and this includes doctors, so they don't realize that vagal AF is the cause of the AF, and therefore the treatment has to be different. And because vagal AF tends to largely occur in relatively young people with no other underlying heart disease, it causes them a great deal of concern because they always say, well, I've never done anything wrong, I've always led a good lifestyle, why am I getting this? So I thought I'd do a little video just so that you understand vagal AF, okay? So the first thing to understand is that our hearts are our heart rate is controlled by something called the autonomic nervous system. All right, the autonomic nervous system is a part of the nervous system that influences the function of our internal organs. These internal organs include our hearts, our stomachs, our pupils, our bladders, etc. So the autonomic nervous system is a control system that acts largely unconsciously. All right, and it has two branches. It has something called the sympathetic branch and then the parasympathetic branch. Now, the sympathetic branch is often considered called the flight or fright system. So when we're scared, or when we're suddenly scared, then we get into this flight and fright mode, where our heart rates speed up, our pupils dilate, our digestion stops, and we're preparing. Our body is completely prepared to try and either fight or run away. Okay, so either fight or run away. However, what many people don't realize is that there is an opposing system which acts to damp down this response after the response is no longer necessary, and that's called the parasympathetic system. And this system is often referred to as the rest and digest system. All right. So in most cases, both these systems have opposite effects, where one system is activated, the other one tries to inhibit it. So, for example, if you're walking along in the middle of the night, someone jumps out at you, your flight and fright response will become activated, your heart rate will shoot up and your heart will pound. However, it doesn't continue pounding when the stimulus goes away, and as you calm down, that calming down is actually modulated by this thing called the parasympathetic nervous system, or the vagus nerve, which then tries to bring the heart rate back down to a state of calm and relaxation. Now, when you're resting, that is the predominant system. When you've just eaten, that is the predominant system, the vagus nerve or the vagal system or the parasympathetic system. That's the main system which is responsible for you resting, calming down, digesting your food, etc. And the vagus nerve is very important because for some people they have something called increased vagal tone, i.e., their vagus nerve is more sensitive, and therefore they have more vagal effects than normal people. And in those people, if the vagus tone is very high, the heart rate can slow down excessively, particularly when the patient is very calm, i.e., at night, and that can sometimes be a trigger for atrial fibrillation to develop. So atrial fibrillation can develop because you've got the excess, fight or fright hormones such as fight or flight hormones such as adrenaline and cortisol, or sometimes it can be because you have an increased vagal tone or an increased parasympathetic system. So who are the people who have vagal AF? The first thing to say is that they're generally more men than women. For every 4 times more men have vagal AF compared to women, okay? And they generally get their first symptoms of atrial fibrillation at a relatively young age, so between 40 and 50, although it's been described in people as young as 25 and people as old as 60. These patients who have vagal AF do not usually have detectable heart disease. And the reason for this is that if you have heart disease, then that automatically activates the sympathetic nervous system. So you don't get this excessive vagal tone because the sympathetic nervous system counteracts it. And so people who have heart disease generally have more sympathetic activity, and therefore you don't get this very high vagal tone or excessive vagal activity. So these people who have vagal AF don't generally have heart disease. And they usually come in to the doctor saying, well, I had AF when I was 40, then I didn't have anything for 3 years, then I didn't have anything for 2 years, but now they're getting a lot more frequent, and now I'm beginning to get I'm beginning to get atrial fibrillation every week. Okay. The interesting thing is, even though they get them every week, it's very unusual for the AF to become permanent. It remains paroxysmal, i.e. it comes and goes. Generally, it takes about 2 to up to 15 years for the patient first to develop their atrial fibrillation, to coming and speaking to the doctor and saying, look, they're getting a lot more frequent. So you can go through a period of relative absence of symptoms for between 2 to 15 years. But then after that, people start coming to their doctors and saying, actually, this AF is getting worse. It's becoming really problematic for me. And the most common feature that people come in to their doctors with is that they say, I'm getting weekly episodes. And usually the episodes tend to occur at night, okay? So when the patient is relaxing, when the patient is going to bed. So at night, at rest, or after digestion or during digestion. So when the stomach is bloated, when the patient has had a heavy meal, that's what triggers off their atrial fibrillation, because those are vagal activities. Also, some people can say, well, my AF starts every time I cough, or if I feel nauseous, or after eating, swallowing, or an ingestion of cold foods or cold drinks. Some people who participate in endurance activities such as marathon running or cross-country skiing, etc., and cycling can develop AF, particularly when they're doing excessive amounts of training. And again, the AF is at night. The AF rarely ever occurs during the daytime. It doesn't occur during exercise. It doesn't occur when a person is emotionally stressed. And a lot of people can tell that their AF is coming on because they start getting these atrial ectopic beats at night. And some people actually say that they can prevent their AFib coming on because they start pacing up and down, i.e. they start exercising. And by doing so, they're increasing the heart rate, increasing the sympathetic system to try and counteract this excess parasympathetic activity. Now, on the ECG, it's very interesting because one of the things which is very characteristic of vagal AF is that the AF starts after the heart slows down excessively. So it's not uncommon if you look in a patient who has vagal AF to see the heart slow down excessively and then suddenly the AF starts. The second thing to say is that a lot of times you see atrial flutter going into atrial fibrillation. But in patients, and not the other way around, but in patients with vagal AF, you often see atrial fibrillation going into atrial flutter, not the other way around. So usually in parasympathetic AF, in sympathetic AF, all other forms of AF, you'll see maybe a little bit of atrial flutter, and then the patient goes into AFib. But in vagal AF, you see patients who go into AFib first, and then they go into atrial flutter, and then they come out of it altogether. So that's another clue that you can get. The other clue is that in patients with vagal AF, generally the heart rate doesn't go up very fast when they're in AF. Usually in AF, you expect the heart rate to shoot up as well, but in vagal AF, the heart rate doesn't go up excessively. So the next question is, what are the kind of things which are vagal and could trigger off episodes of atrial fibrillation? Because if you understand those, then if you can avoid them, then you may not get as much AF. So bending down, sitting down, lying down, drinking cold water, eating cold food like popsicles, frozen yogurts, that kind of thing, jumping into a cold swimming pool, gas buildup in the stomach, eating a heavy meal, coughing hard, alcohol, straining when on the toilet. Those are all things that can trigger off AF because they're inherently vagal. And if you can avoid doing these things, and sometimes it's just impossible, I appreciate that, if you can avoid some of these things, then you may not get as much AF. So particularly things like bending down. If you have to bend down, rather than bending down, the waist, it's better to keep your back straight and bend down using your knees, because that's undoubtedly less vagal than bending down and pushing on your stomach. It's very important to try and keep your meals in the evenings light, and it's important to avoid things which are very gassy, and it's important to avoid spicy foods, and it's important to avoid eating late at night. Okay, those are easy adjustments you can make that will reduce the likelihood of AF at night. It's very important at all times to keep yourself well hydrated. When you feel an episode coming on, a little bit of light exercise, like jogging on the spot, will take the AF away. Some people say that sleeping on their left side can trigger off the AF, and if you could sleep on your right side or on the back, sometimes the AF can go away. Now, I did a video on the vagus nerve, and when I was reading, I found that actually lying on the right side is also a very vagal position. But the experience I've come across from patients is that actually lying on the left side seems to make their AF worse. Also, if you can elevate the head and the upper part of the body when sleeping, such as by using several pillows or adjusting the bed so that the head of the bed is higher, that can also help a lot of people. Also, people who are endurance athletes, if they can detrain for a little while or just step back from the training, then that can help the AF as well. In terms of medications, it's important to realize that when we think of AF, we often think of it being a sympathetic AF driven by adrenaline and cortisol, and we often give those patients beta blockers or calcium antagonists or digoxin. Those agents do not work in vagal AF. In fact, they can make vagal AF worse. And this is the main thing, that if you can identify yourself as being a patient who has vagal AF, then you should try and avoid beta blockers or calcium antagonists or digoxin. And instead, agents such as flecainide or quinidine or disopyramide or amiodarone are more effective at preventing AF. Amiodarone is not a great drug because it has lots of side effects, but it can be quite effective. Now, in terms of stroke risk, that has to be based around the CHADS-2 VASC score. As I say, most of these patients who get vagal AF have very, very low CHADS-2 VASC scores, so they probably don't need anticoagulation. But again, it is important to know what comorbidities the patient has, and if there are the comorbidities associated with strokes, then the patient needs to be anticoagulated regardless of the mechanism of atrial fibrillation. One other question people will ask is, what about ablation in vagal AF? And the problem is that there have been no specific studies looking at the success of ablation, in particular in vagal AF. But it is worth asking your GP or your doctor to get you to see a cardiac electrophysiologist who may be able to advise you on that. So I hope this was a quick run through on vagal AF, a poorly understood condition, something that causes a lot of distress to a lot of patients. And I hope that by understanding why it occurs and avoiding some of the triggers and going on the right medication, it will help. One last thing, by the way, is magnesium helps as well. So if you haven't tried it, try oral magnesium supplementation. If you come to my Facebook page, or actually even at the bottom of this video in the comments section, I'll put a link for the magnesium I recommend. That's only because I have given it to some patients and they've found it to be helpful, not specifically for vagal AF, but also for ectopics, etc. So it may be worth trying some magnesium as well. And particularly in people who are endurance athletes, there is some suggestion that they may be hypomagnesiemic. You cannot rely on the blood tests, so hypomagnesiemic, and therefore taking magnesium may help. So I hope this was useful to you. Thank you so much for watching. I'll keep trying to put videos out twice a week at this point in time, so I'll keep trying to do that. I really, really appreciate all the really kind words that you write, all the great messages that I receive. It empowers me, it makes me feel enthusiastic about my day. So, whilst a lot of people appreciate the fact that I do this. I really, really appreciate the fact that you take the time to listen, and I really appreciate the fact that you actually take the time to write to me. So if I haven't written back, I'm really sorry. Work is hectic, but I will try at some point to get around to answering everything. Um, if you get a chance, please do consider sharing the video. It would be great for me. It would, one of the real joys I have is to get up in the morning and say, "Oh, look, I've got so many subscribers," and it just makes me feel good, and the day goes a bit quicker, and that's really, really nice. So, if you get a chance, please consider sharing it. Please consider telling your friends about this channel, and I'll try and keep producing some relevant and helpful content for you. Thank you so much. All the best. Oh, by the way, sorry, my website is www.yourcardiology.co.uk. My Facebook page is yourcardiology@gmail.com. Send me a message, come and join me on Facebook, and we can communicate. All right, all the best.